Hello and welcome again to another episode of Sacktown Talks. It's your host, Jarrett Blonian, joined today by Shawnda Westly to talk a little bit about MICRA. Shawnda, thanks for joining us. How's it going?
Pretty good now.
Getting better every day, exactly.
Yeah.
So Shawnda, I guess kind of give us a little background about yourself and kind of how you kind of got interested in the topic of MICRA.
I am a medical malpractice survivor. And so while I do a lot of things in politics in general, this is not one of those that I work for, except in my spare time as a volunteer. So when I was 45, which was 5 years ago, I went to the ER at midnight because I had a pounding headache, and it wasn't like any other headache I'd ever had. Mm-hmm. And I let them know that. And they told me I had a migraine. So they gave me some meds and then they sent me home. But what they sent me home with was a huge clot in this part of my brain, which was growing. And luckily it was a venous clot. So I was still getting oxygen, which is why I could still talk and walk. I was just in a lot of pain. And after misdiagnosing me and sending me home and not doing a simple CT scan of my head, I ended up back at the ER in 24 hours and didn't know the name of my son. So I ended up having a stroke and a clot in my lung, which could have killed me, and also a DVT, which is a deep vein thrombosis in my leg. So I was basically like clotting all over my body.
Wow.
By then. And I spent a lot of time in the hospital.
And guessing this all could have been prevented if one doctor had noticed it in the beginning.
Maybe.
Is that right?
Maybe. So, I mean, and the tough part for me is that's not my only story. It's the story I talk about because I finally, I try not to get emotional and talk about it now because I've talked about it a lot. So it's like a callus, you know, mm-hmm. But it does bring out emotion sometimes. I'm warning you.
Right.
But I had a son this time. And so I was very concerned that I had my son on my own. And when I did that, you know, I'm his parent, period. And he couldn't lose me. Mm-hmm. And so what was frustrating is not only did they send me home saying it was a migraine, but when I came back, they told me it was a tumor, which it wasn't. And then they, after being there for like a week, I think it was, they sent me home again, even though I was coughing up blood and phlegm and had a pain in my back, which are stereotypical symptoms of a pulmonary embolism, which is a blood clot in your lung, which can basically just, you know, make it so you can't breathe anymore. Right. So I went home with that. And then the next morning I was in my primary physician's office, like crunching on her exam table in so much pain. She sent me back to the ER. That's when they figured out I had a PE. And that's when they also checked my leg and found the deep vein thrombosis. So one story I don't talk about is when I had my son, he was almost 10 pounds and he had an infection on his back. And when they drew a circle around it and sent him home, but then it grew in the first 4 days. We ended up being admitted into a hospital or he was admitted, me with him. And I never felt okay after giving birth. And I kept telling doctors something's wrong with me. And they're like, no, honey, you had an almost 10-pound baby. It hurts, which is true. Different than the pain in my head, though. I know what pain is. So I ended up causing a big fuss at that point. And finally, after many days, got like one of the best doctors to come in. And he looked at the doc who'd been taking care of me and he goes, okay, why the fuck isn't this kid on antibiotics? And he immediately took him and said, I know you're stressed out and I'm really sorry, but I have to go take him into surgery right now and, you know, get this infection out and pump him full of antibiotics right now. We don't know what this is. And I was like, oh my God. And then he's gone. And then I'm just white. And it wasn't until a nurse who came in because they spend more time with patients. She looked at me and she said, honey, you're not okay. And I'm like, oh my God, finally someone's listening to me. And it was a nurse. She put me in a wheelchair, took me down to the ER, and it turned out I needed 2 pints of blood. That's how much blood that I had lost during the delivery. And so not only that, then I told the guys who were doing it, I'm getting a fever. They're like, no, by our records, you don't have a fever. I'm like, no, I'm getting one right now. Something's wrong. It turned out I was having an allergic reaction to the blood transfusion, and they neglected to give me the Tylenol and Benadryl, which is like common practice right before a blood transfusion. So that was my first episode. Fast forward to, being told I was going to end up in a nursing home when I had the stroke. Luckily, the what happened to me, I was okay 3 months later. So lucky. But I think it started because they looked at me, relatively young, 45-year-old woman who didn't understand what pain was, because we're the fair sex. So they're like, oh, she doesn't know. This is what a migraine really feels like. So that was the problem. It was the implicit bias of the doctor, who I've now personally forgiven in my heart for making the choice that she did. But I didn't present to someone who they would have assumed had stroke.
And I guess how did this lead, I guess, to your interest in MICRA and microcaps?
Well, the one thing that I noticed in both of these cases, it wasn't until I escalated politically because of my background. So my background, I ran the party for 8 years with John Burton, and I was a Democratic consultant, and I also worked for the firefighters union prior to that. So I knew people. Well, that's bullshit, because I was able to finally escalate this to where I got really good care because I had the ability to reach the right person to make the right call. And if I was unemployed, well, let me go back. What MICRA is when something like this happens, is getting justice for that victim. So after this happened, and I knew it was a mistake, I wanted to sue, because I wanted them to change their policies. I wanted them to change. It was Sutter Medical Center. I wanted them to look at this and say, okay, we made a mistake here. How can we improve? And what did they do? They went like balls to the wall. We're not talking to her. Make her sue. Make her go find a lawyer. It's just typical to protect themselves. And a lot of times, like, the one thing I think that a lot of people about MICRA, they think this is docs versus lawyers. It's not. It's people like me, patients, versus medical malpractice insurance companies. It's insurance companies and patients having the conversation, masked by their ally, which is lawyers and doctors. And for me, had I not made it out of that hospital, or if I had ended up in a nursing home, there are two types of damages I could sue for. I learned more about this law than I ever intended to through my experience. There's economic and there's non-economic. So I would have been one of the lucky ones, because I made X amount of money. And if I wasn't going to be able to work for the rest of my life, they would have to look at all of my loss of earnings over my lifetime. My son would be okay. He's in the other room. My son would be okay. I would have enough money to function and live like a regular person in society. Then there's also non-economic. A lot of people like to call it pain and suffering, but non-economic damages is the harm to the patient that is not specifically related to their wages or the cost out of their pocket. So who does that apply to? It applies to people who are unemployed, people who make less than someone like me, people who are retired, people who are paid less, like women are usually paid less than men, Right. So many people who, if they had been in my situation, might not have even been able to find a lawyer. I had a lawyer who was willing to sue. I ended up pulling back because I wanted to be able to say something in public about what happened and be an advocate for people like me. So those people don't have a voice in the Capitol. Their voice is, in a way, the lawyers, but so many medical malpractice lawyers I've talked to, many of them don't take cases like this, the capped cases, because they can't afford it anymore.
Right.
The cap is $250.
It's $250? Is that what you said?
$250,000, which is based on when the bill was signed in 1975. That would have been equivalent now to $51,000.
Wow.
In 1975 dollars. So I learned a lot of other things. One of the things that I learned is that you only have 1 year to sue. I had stroke brain for 3 months.
Wow.
But you have 1 year to sue from the time of the injury. When people go to court, the jurors are not told about the cap. So the jurors will sit there and be like, this is a great case. I want to take care of this person. We're going to give them X amount of money so they have enough money to live their life. But then as soon as they leave, say it's a little girl. There's a story that of this girl, Mia Moreno, that'll just break your heart. 5 years old, she was left unsupervised and sedated, and she ended up having a major brain injury. And her mom has now quit her job to take care of her and become an IHSS worker to do so. And she gets health insurance off of her because of her father's job. If he's still employed, I don't know, because of the pandemic. But this little girl is limited to $250,000. And she won't even get that much.
Right.
It's usually for death. So her entire life, a life that she could have lived, I'm not even saying in comfort, just the bare minimum, she will always be taken care of by other people. She can't feed herself. And that's the limit we put on what she can be awarded for a medical mistake. Doesn't make any sense to me.
No, not at all. I guess kind of what are some of the resistance to raising this cap and changing this law?
Well, like I said, it's always been docs versus lawyers, but that's not it. Because, the interesting part is the doctors I know now are the ones who want to make things right. I have some great caregivers right now. And I don't think your average doctor wants a patient to not be compensated to be able to live their life, because we're not talking about millions of dollars here. But the medical malpractice insurance companies have convinced them that their medical malpractice insurance rates are going to go through the roof. So you should be concerned. Well, Prop 103 allows us to regulate those prices. It's what the insurance commissioner does. When that measure was passed, the price went down 20% for their medical malpractice insurance. So that is at the heart of what a lot of people talk about. For a patient, though, it's a lot bigger than that. It's there's medical errors that can have structure to fix them. This isn't, to me, it is about making sure the patient is able to live a life. But it's also fixing the underlying problem, which is medical errors. You had asked me ahead of time about medical errors. And in 2016, Johns Hopkins did a study that took about 8 years to do to figure out how many deaths medical errors are responsible for. And it's 250,000 a year, which means before COVID, the third leading cause of death. So how do we fix this? There's, oops, I amputated the wrong leg on the wrong patient or forgot a sponge in somebody's body when I was doing surgery. Totally normal mistakes that happen. Not okay, but it happens. So you can put guide rails on that. You can have a checklist. You can have regulations that say, count the sponges, count them twice, third person counts them, whatever. Now, before we close them up, count the sponges, right on the arm, have the patient right on the arm, things that can fix those. Then you have like that surgeon who decided to do his traffic court call via Zoom while he was in surgery.
Yeah.
That's unfixable. That's just arrogant. But the thing that we really have to get to fix the issue of medical errors is, well, first of all, realize we're never going to totally fix it, but we can make it better, is that everyone who's in a medical situation, anybody in life has implicit bias. We hear about it for other issues like policing issues and others, implicit bias where you think certain things about a person without realizing you do think that way. Mm-hmm. So just like when I went into the ER and she was like, this isn't somebody who is having a blood clot growing in her brain. Right. I didn't look that way. Right. Same thing happens with a lot of people. So when you look at medical errors, people of color are the ones who are most harmed. They receive fewer cardiovascular interventions and renal transplants. Black women are more likely to die of breast cancer. People of color are less likely to get pain medication. Why? Because they think that they're all drug addicts. Like, what is that about? How do we fix that part of our society? There was a study in 2003 from the Institute of Medicine, which actually looked at all the subgroups. There are 11 subgroups that are harmed by implicit bias in our medical industry. And that is something that we can only chip away at. And it's never going to get completely rid of errors, but it's definitely something that we need to try to focus on.
The $250,000 cap, kind of in your mind, what does that need to be raised to, or should there be a cap at all?
People will kill me when I say there should be no cap, but there should be no cap. The reality of that happening is unlikely. And I do work in politics, but there's something that's achievable, I think, either on the ballot or in the legislature. I think that what was interesting is when I decided to be vocal about this, I heard from a lot of legislators and legislative staff who have had family members. Most people know someone who's been harmed by a medical error. Mm-hmm. And it was interesting to me, even some hardcore Republicans were like, so let me tell you about what happened to me, Right. So there's ways to fix it. Right now, they estimate that if we just did a COLA, it'd be $1.3 million. There is a good argument to end the cap for catastrophic injuries like MIAs, There are other parts of MICRA that I also think deserve some attention. One of those is periodic payments. Okay, great. You got me. I'm going to have to pay you $1 million, but I'm going to pay $25,000 a year because I know you're going to die in 5 years. Right? So there's periodic payments that are part of this law. So you don't just get paid lump sum. They can eke it out and then stop the payments if you die, which I think is just draconian. Another thing that a lot of people don't know, and when I learned it, it took me like a month to get it straight in my head exactly what it was. And it's called the collateral source rule. So the collaterals, have you heard that one before?
No.
Okay. Nobody has. It's, do you have an iPhone?
Yeah.
Okay. Let's say I'm in the studio with you, and I take your iPhone and I throw it against a wall and it shatters. Won't work anymore. Do I owe you an iPhone?
If I can collect it from you, right?
Right? Yeah, I should get you an iPhone. That seems legit.
Right.
But let's say, I don't know if you pay for the Apple Care, but let's say you have Apple Care. You have Apple Care?
Yeah.
Okay, good. So you should have Apple Care. So now I don't have to pay you for your iPhone because you already paid for insurance. In Discovery, I figured out that you have insurance. So I don't have to pay you shit. That's the collateral source rule. And that is applicable only in the, or exempted in the MICRA law. That means that kid, Mia Moreno, that little girl, since her father has healthcare and she's on his policy, no reimbursement because he's already paying for her healthcare. Right. If he loses his job, can't pay his healthcare anymore, he goes on Medi-Cal. And his wife's already an IHSS worker. So our tax dollars are already going to pay for Mia's care, which I am happy about because that's at least something that she's not getting from the system that's completely undermined her recovery and her life. But the collateral source rule is something that definitely should be looked at, I think. It's something a lot of people don't get as part of this. And I wish that when the brainiacs who put MICRA together and decided not to have a COLA on that cap, if we had a COLA on that cap, it'd at least be 1.3 right now. But they didn't.
I guess, have you looked at forming an initiative and kind of what groups would be interested in kind of pursuing this and taking this to the voters?
There's a lawyer who put that on the ballot with his own money. His family, he probably wants to tell his own story, but he's been directly impacted by, he has defended doctors in court and he's prosecuted them. He's a former medic in the Army. And so he's seen both sides of this conversation. But his family was affected by severe catastrophic medical malpractice, as well as that being his gig, right? Mm-hmm. So he wrote a measure and he got enough signatures to put it on the ballot. So that'll happen in 2022. And
oh, wow.
I mean, most of the people who are supporting it are lawyers, of course, because who else has money to do it?
Right.
But the people who also put that on the ballot are victims or survivors and victims of medical malpractice. It's not just him. And
I guess how would it change MICRA?
I think it does. I don't work for him or the campaign. It's too emotional for me. I can't engage professionally on it, but it increases it to 1.2 or 1.3 and then eliminates the cap in catastrophic. The other thing that he put in there, which was, I think, controversial in his community, was a certificate of merit. Instead of lawyers writing letters like demand letters for medical malpractice suits, they would have to have actual background, having already paid for a doctor to review the records and to say this is a meritorious lawsuit. So if it has a certificate of merit, meaning that that it's not just a demand letter, then he or she can send that in, and he has to sign it under perjury laws. So he could lose his license if he was lying. So that, I think, he put in to kind of bring the responsibility not only to the medical malpractice insurers to do the right thing by the patients, but also that the lawyers can't just send out, 100 demand letters around the state right. under the new law.
I guess, is there some acknowledgement amongst insurance companies or, the medical community that this, cap needs to be raised and it would be reasonable to do so?
We're in a political world, and the people working on the other side are getting paid to do it. It's hard because people want to see their doctor and feel faith in their doctor and trust in their doctor. And so when you hear these stories, it's like, well, that was her, that was him. That's not me. My doctor's great. You know, the people who, I mean, there is an organization that actively is funded by medical groups and also insurance companies who fight any change to MICRA. And it's one of those issues that, like, when candidates are running, they don't really know what it is. They've heard to stay away from it because it's very controversial. But once you start to like get into, this is actually what we're talking about, it's like, 1975 and it hasn't gone up. And then, you know, one thing that I think that we don't talk about is that this isn't 1975 anymore. And I'm not even talking about the amount. I'm talking about who pays. You have doctors that are paying their medical malpractice insurance, but they're not, like, I remember I had Dr. Cora Oka. She was my pediatrician, and she had her own, you know, it's like, I'm older than you. You had these individual doctors' offices where you would go in, and you know, there was no internet. There was no medical records that you could have access to. It was just, you called the doctor, you made an appointment, you went in. It was very personal. Now you have doctors who are, by choice or by force, I don't know, working with these big medical corporations who are buying up, like Sutter did, which is why AG Becerra won the lawsuit against him, that they still owe the state. I think it's $600 million, $575. Wow. That could really help out if they paid up. But when they lost that lawsuit, it was over anti-competitive prices. So you have healthcare companies gobbling up labs and physician practices and hospitals and clinics, so they can drive, we're getting off topic. I'm getting off topic, but I'm not. And they can drive prices up. Once they own everything in your town, then you're screwed. You can only go there, and that's what the price is, right?
Right.
How does that factor into this conversation? Where's their culpability or liability? Was it Sutter Medical Center who said, don't do the CT scan, you know? And then the doctor's the one who really gets sued. Like, is that fair? Shouldn't they have some skin in the game if they're making so much money?
Right. And they're pushing cost savings.
Mm-hmm. Right.
What is, you know, MICRA caps look like in other states? Do other states have caps, or, you know, does this exist in the rest of the country?
They do. You know what? I thought you might ask me that, so I looked it up because I didn't know. 23 states have a cap. Of the 23 states, 7, including us, have 250. We're the lowest. Do you know who's higher than us?
Mississippi.
Yes. How did you know that? Did you look it up?
It seems to be the answer to any question. Like, what? We're below Mississippi?
It gets better. Tennessee, 3 times higher than us.
Right.
With a cap blow if it's a certain kind of injury. So yes, Mississippi and Tennessee, where their cost of living's lower, have higher cap.
Way lower. Yeah. You can actually buy a house out there for $250,000, I think.
And one of my very good friends lives in Mississippi. It's wonderful. They are going to go blue one day. I truly believe it. But apparently they care about their patients of malpractice more than they do in California.
Well, this has been awesome. Thank you so much for kind of sharing and talking about MICRA. Is there anything else you want to get out there before we go?
It's I say this whenever I can to people. If you go to your doctor, if you go to the ER, your regular doctor, wherever you're going, you take a pad of paper and a pen and you write down what they say, and you date it, and you put time, and you say their name, and you ask them to spell something or correct something. The minute a doctor knows that you're paying that close attention, they slow down. They are human. Like, their goal is to do no harm. And I completely believe that that's what they're trying to do. But sometimes things happen. And when you can get them, you know, these corporations make them go in and out with patients, right? Right. Like that nurse who saved me because she had time. They're forced to do too much too quickly. slow them down, write down what they're saying, and you will find out that they slow down and they process you as a patient in a different way, probably in a way that they would prefer to, but usually aren't given that luxury.
No, well said. Well, thank you so much for joining us and sharing your story. Definitely interesting, and look forward to talking to you more as this kind of initiative process unfolds.
Awesome. Thank you so much.
All right. Thanks,
Okay.
Shawnda.
Bye.